Good morning, everyone. My name is Dr. Andrea Fong. I'm a pediatric allergist and clinical immunologist based in Regina. My CQIP project will discuss the use of food allergy screening panels in Saskatchewan. In 2016, Choosing Wisely Canada included food allergy screening panels as one of the tests that patients and healthcare providers should question before ordering. Their recommendation states, don't perform screening panels, that is IgE tests for food allergies, without previous consideration of the pertinent medical history. So what are food allergy screening panels? When someone develops a food allergy, their body produces IgE antibodies directed against the food that they are allergic to. Food allergy screening panels test for specific IgE antibodies to multiple foods at the same time and unfortunately have a high rate of false positives. Without a convincing clinical history, the false positive rate can be as high as 75%. So the goal of my project was to reduce the number of screening panels for food allergies ordered in this province by 90% by December 31st, 2020. In my driver diagram, we identified the following primary drivers, and we'll go through one of them today. So for the primary driver of order process, we identified physician knowledge and selection of tests as secondary drivers and came up with the following change ideas. At this time, we are discussing education sessions for areas with high rates of ordering screening panels, education handouts like flowcharts for clinics regarding the proper indications for allergy testing, potentially changing the lab requisition itself so that physicians must specify what food-specific IgE levels they are ordering. Currently, it's just a tick box, and once you just check off that box, it orders 5 different food allergy tests at the same time, and potentially removing the test. So where are we in terms of implementation and results? Currently, we've met with our PFAs. The bulk of our work still is in the process of collecting data. As something that we did find out, in 2019, about 2,000 of these food allergy screening panels were ordered in the province at a cost of approximately $280,000. The challenges that we encountered included who we would reach out to get the data that we even needed. Once we got the data, we found that there was some discrepancies in terms of the ordering physician. So just even getting the correct data was a challenge, and of course the delays due to the current pandemic. So my key learnings and reflections reflect a lot of what my cohort participants have already mentioned. I certainly went into this project just leading with the solution of we just need to remove this test. But I really appreciated the learning process of looking into root causes and always asking why. I am also someone who thought that it would be very easy to make this change, and I've learned that change takes a lot of time at the best of times, even when we're not in a pandemic, and certainly this past year has tested that as well. I also came into this project just as an individual, and I'm walking out with a team of people who are helping me, and that was something I didn't expect, that I would leave this project with more people on my team to help me further this project, as even with the end of CQIP, I am definitely planning to see this project through. And with that, I would like to acknowledge the organizers, coaches, and my fellow participants for all the learning that was provided this past year. My coach, Dr. Christine Lett, Michelle Dagelman, who has helped immensely with my data, and of course, the invaluable input from my PFAs. Thank you.